Hello and welcome back to GP Video Podcast by Nadia. So today the topic that I'm going to talk about is called Smoking and Diabetes, Taming of Two Monsters. Basically, this is a very good presentation that I found on LinkedIn. It's prepared by Dr. Tariq Al-Arini, who is an internal medicine and diabetes consultant in one of the Arab countries. So I found it very interesting and I really wanted to share it with you. So basically what it says is that decades of research has shown that there is an intimate connection between cigarette smoking and diabetes. So smokers have a 30% to 40% higher risk of diabetes than non-smokers. Okay, so as I said that smoking raises the risk for type 2 diabetes by 30 to 40% according to the Centers for Disease Control and Prevention. Okay. The association in the studies has shown a dose-dependent pattern. A higher daily amount and longer duration of smoking is linked with increased diabetes risk. So the more you smoke daily and for a longer duration, the more you are at chance of developing type 2 diabetes. Till now, we have been talking about obesity and the risk of type 2 diabetes. Now we are talking about smoking and increased risk of type 2 diabetes. So what is the pathophysiology? How does this happen? Certain chemicals in cigarettes cause insulin resistance, which can lead to type 2 diabetes. The more your cells are resistant to insulin, the more you are prone to get diabetes, because that is the pathophysiology of developing type 2 diabetes. Smoking is also associated with the accumulation of abdominal fat, another risk factor for diabetes. Exposure to passive smoking. So if you're not a smoker, but if you live with a smoker and you are exposed to passive smoking, has been shown to increase the risk of developing metabolic syndrome, glucose intolerance, and type 2 diabetes. So what is metabolic syndrome? High cholesterol, high sugars, or increased insulin resistance, high BP, type 2 diabetes. So this is like the four factors that I said: high BP, high sugars, high cholesterol, and obesity. Four things. I said this is what comprises diabesity or metabolic syndrome. And then again, smoking actually is the factor that can increase your risk of having these four things. Strange, isn't it? But it is true. Okay, then we have got combining the two devils. Smoking and diabetes is like doubling up on the damage. The condition snowballs inflammations, high levels of stress hormone cortisol, toxic abdominal weight, vascular constriction. These all affect each other and you are being hit from all directions, and the result is alarming. So as I said that all these factors snowball. So if you are obese, if you're a smoker, you are going to get increased levels of insulin resistance, then your cholesterol levels are going to go up, your BP is going to go up, you're going to become more fatter, you're going to have more abdominal obesity, then you're going to get more stress hormone cortisol, which is again going to make things worse, the inflammation worse, your obesity worse, and then you're going to have all the vessels constricted, which is again going to give high blood pressure, as if you are being hit from all the directions. Okay. Meanwhile, people with diabetes are already at 3 times more likely to die of cardiovascular disease. The damage from smoking increases that risk by another 50%. So if you are a type 2 diabetic, you already have a 20 to 30% more chances of getting cardiovascular disease like a heart attack. And then if you are a smoker as well, then increase that percentage by another 50%. So you are 3 times more likely to die of cardiovascular disease if you're a type 2 diabetic. And the damage from smoking, if you're a smoker as well, that will increase the likelihood another 50%. So my maths is is not good. So you can now calculate, because I've told you all the calculations. Okay. Compared to non-smoking diabetic patients, smoking diabetic patients have been associated with the following: decreased insulin sensitivity, possibly due to increased circulating levels of insulin antagonistic hormones, example catecholamines, cortisol, and growth hormone. So there are two people, one who's a diabetic and a non-smoker, and one who's a diabetic and a smoker. So people with a diabetic and a smoker are at increased risk of what? So their insulin sensitivity is decreased because in your body, the hormones like cortisol that I have said, which is a stress hormone, then catecholamines and growth hormones, which are actually anti-insulin. They are the ones that increase the blood sugar levels. So they are circulating more. So your insulin resistance is actually increased more and your insulin sensitivity is decreased. So your diabetes control is very, very hard. Impaired control of glucose and cholesterol metabolism, and increased blood pressure, total cholesterol, and obesity. So smokers are more prone to obesity if they are type 2 diabetics. So you can just say, and even if they are not type 2 diabetics, even then they are at increased risk of getting abdominal obesity. So that is a myth that smokers could be very lean. Yes, smokers could be very lean because of other reasons, but they can also increase obesity, especially if you are prone to get obese, if you have got genes for it. So you are more prone to get abdominal obesity, and you are more prone to get high cholesterol, you are more prone to get high insulin resistance, and you are more prone to get type 2 diabetic. So again, it's two-pronged. If you're a smoker, you are at increased risk of developing type 2 diabetes. And if you're already a type 2 diabetic and a smoker, you are at increased risk of developing complications and increased risk of more insulin resistance, more glucose control problems, more high cholesterol, more high blood pressure, and more obesity. We'll talk more about this tomorrow.